Hey there, this is Dr. Firnhaber, and it's time for another 10 Minutes of Truth. We do that on Wednesdays. The last several weeks, I've been covering some issues out of this book by Robert Lufkin called The Lies I Taught in Medical School. Very interesting book. I'm learning some things, which is good. I always like to learn. So we're going to talk about two more lies that he dealt with, that he's talking about, that he taught in medical school. So the first one is the fatty liver lie. And here's the lie that he was teaching his students. There's no treatment for non-alcoholic fatty liver disease. So we want to just talk about fatty liver disease first and talk about the two types of fatty liver disease and how it happens and what it does in the body, and then how to correct it. So there's alcoholic fatty liver disease. So just drinking alcohol causes the liver to accumulate fat, and then eventually, if that goes on for too long, goes into cirrhosis, which is a severe liver disease. And once you get to that point, it's pretty hard, if not impossible, to reverse it. And that's one of the causes for liver transplant. So there's another type of liver disease called non-alcoholic fatty liver disease, which we didn't even see in the United States until after 1980. It did not exist. So physicians always assumed that fatty liver was caused by alcohol use, until after 1980, they started seeing it in children. And these children weren't drinking alcohol. So what was the cause? Well, the cause is fructose. Fructose causes fatty liver disease. So where did we get fructose from? Well, there's high fructose corn syrup, which is in most of your soft drinks, or a lot of them, and a lot of your processed foods. There's also fructose is just part of the regular table sugar molecule. So sugar, table sugar, sucrose is a disaccharide, meaning it consists of two parts. You have glucose and you have fructose. So when you eat table sugar, it goes into your body splits it, the glucose goes into your blood, your body uses it primarily for fuel, although if you have too much glucose, it can be turned into fructose. Now, where does the fructose go? It goes into the liver, because metabolizing fructose is a lot more complex for the body than metabolizing glucose. So it goes into the liver. Too much fructose over time starts creating fatty deposits in the liver, and that creates non-alcoholic fatty liver disease. Now, there's some interesting things that he brings out in the book about that. Number one is, if you've ever had a CT scan or an MRI scan of your abdomen, this is one of the primary ways that you can see fatty liver disease. And he said it's become so common that radiologists don't even talk about it anymore. They don't even put it on their report of findings, because so many people have it, because so many people are addicted to sugar and eat and drink food-like substances with high fructose corn syrup and sugar. So he says fatty liver disease is one of the leading causes of liver transplants and is a bellwether for metabolic health. He said it's off the radar for most physicians. So when we eat too much sugar, even the glucose can be converted to fructose. A small amount of fructose is converted to glycogen, but a significant amount is turned into alcohol. So your body, part of this process is your body takes fructose, turns it into alcohol, and then the byproduct of that is uric acid, which leads to gout, urate stones, and global tissue inflammation. Uric acid also inhibits other chemicals in the body. This can result in dementia, hypertension, and impaired immune system functioning. reducing white blood cell mobility and causing higher infection rates, even cancer. So we know basically from this is that too much fructose is a very, very bad thing for the body. Now, he also says something else that's very interesting, is that too much salt actually stimulates the production of fructose. So in the body, for eating, you have too much salt in the diet that stimulates the production of fructose and can actually contribute to gout and fatty liver disease. So what is the lie? The lie is this, is that by eliminating or severely restricting sugar in the diet of any kind, you can, and eating only moderate amounts of salt, not huge amounts as you get in most of your processed foods, you can reverse fatty liver disease over time. So the next chapter is what he calls the hypertension lie. And here's the lie that he talks about. I'll just read it to you. High blood pressure is best treated with drugs. Now, his contention is that high blood pressure is very bad, and I would agree with that. It causes a lot of problems in the body, heart disease, stroke. It's associated with all kinds of things. But he says the pharmaceuticals are only treating the symptoms. He says with many factors, while many factors control blood pressure, hypertension has many of the same metabolic drivers as obesity and diabetes. They often appear together, indicating a wider metabolic syndrome. But what mechanism drives this process? Well, the mechanism is our diet and our lifestyle. Alcohol, table sugar, and high fructose corn syrup, and a high salt diet cause problems in the arteries, which stiffen the arteries, elevates fructose, and causes high blood pressure. He also says this, that air pollution is also a contributor to high blood pressure. High blood pressure from environmental pollutants is also shown to be dangerous to pregnant women who live near busy roadways. Women who live within a quarter mile of a major roadway are at increased risk for hypertension, and this condition makes preterm births more likely. So, here's what he says. Unbalanced diets and sedentary lifestyles influence the body's cells to malfunction, creating toxic amounts of substances that would normally be helpful. The relationship among hypertension, obesity, type 2 diabetes makes it clear that many issues with blood pressure are external. Hypertension is also associated with the risk of prostate cancer, breast cancer, liver cancer as well. Half of patients with arthritis also have hypertension, and non-steroidal anti-inflammatory drugs, or NSAIDs, used to treat hypertension or arthritis actually increase blood pressure, making the problem worse. So he says, want to avoid screwing up your blood pressure? Don't drink. Decreased alcohol intake and decreased processed food consumption reduces a chance in a metabolic syndrome, the cause of all these issues. Of course, don't neglect physical activity as well as sleep. So here we go. The non-alcoholic fatty liver disease and high blood pressure are basically lifestyle and nutritional issues, just like most everything else that he's talking about. So next week, we're going to talk about the cardiovascular disease lie and probably the cancer disease lie. So I hope you got something out of that. This is Dr. Robert Lufkin, and I'm Dr. Paul Firnhaber here in Lincoln, Nebraska at Lincoln Disc and Nutrition. If you want to get in touch with us and you're interested in our chiropractic or functional medicine programs. That number is 402-540-1166. We'd love to talk to you and to help you out with either yours or your family's health care. So that's all I have for today. We will see you next Wednesday. I'll be here with another edition of 10 Minutes of Truth. We'll see you then.